I'm going to be talking to you now around developing your research questions and also moving on to aims and objectives. So we're going to cover the research question, a bit about title, and a bit about aims and objectives as well. So just thinking about how do you come up with a good research question. So when thinking about that, you need to think about kind of what criteria will your research question be judged upon, and then also think about can you clearly articulate that question, ideally in a single sentence, but sometimes it's not possible. So just trying to think about how we can get that question across in a simple way, which is understandable. So, thinking first of all about criteria. So, I'm going to mainly be talking about NIHR, but this is really applies to any fund you're applying to. Every funder will have particular criteria which they're interested in too. So, if you're thinking about NIHR and other funders, what we really need to know first of all is how bad is the problem? So, what are you trying to address the problem for? Then think about kind of what don't we know yet, and how might your research help answer what we don't know? Will what you do make a noticeable change? And are there any people out there calling for this work other than you? In addition to that, every funder has got their own particular criteria. So, for example, NIHR are particularly interested in projects that have a short to medium term benefit to patients and or the NHS. But within that, every funder has slightly different priorities. So this just shows a number of different NIHR funders. Have a look at the criteria that your funder has. So these are NIHR funders here, but if you're looking at, say, UKRI, MRC, they've also got their own criteria, as have charities. They've all got a research strategy. So look at your funder criteria that you're interested in and make sure research fits within that. If you're unsure, most funders don't mind you dropping them a quick email to ask, but that's not the case with all funders. But come to the RSS and we can give you a hand with that as well. So, thinking about the need for evidence. So, what do we mean by that? We're thinking about, so in the application, we're thinking about, how bad is the problem? So, the scale of the problem, how many people does it impact? Does it impact a particular patient group, or is this about a particular sector of society? Is it carers? What does the problem cost? So that's kind of what we're looking for in that opening bit of your application. Number of people, impact on the person. Does this affect a lot of people, a bit, or is it a rare disease, which is also fine to affect a small number of people but has significant impacts? And we need to understand that impact on carers, NHS costs, and other costs as well. The need for evidence. So what don't we know? So what does literature say? What's out there? And what are the gaps you have identified? So being able to explain that clearly and set your work within that background is really, really important. So are you targeting a reasonable proportion of the population? So is this a big problem that's affecting lots of people, or is it a subset of that population, or is it a rare disease population? We just need to know, who it's affecting and the sort of change it's going to notice to that population in particular. So then thinking about who's calling for this work. So this is really about trying to sort of generate some level of enthusiasm in people who might only have a vague knowledge of your idea. So when you're going to a funding committee, quite often you might only have one person who's a really a strong expert in your field. Everyone else might not particularly understand it. So just trying to show there's some enthusiasm for people outside of the team putting the application together is really helpful. That will just make sure there's no doubt in everyone's mind that the work you want to do is going to really benefit patients or carers or healthcare professionals or the NHS more widely. It can also help you make your research stand out. So, for example, if the James Lind Alliance, for example, has run a recent prioritisation partnership in your area, have a look at there, see if there's other people calling for research through that field. Look at nice guidance. Every bit of nice guidance has research recommendations at the end of it. Does your research align with one of those? Look at various reports from the various different Royal Colleges, so the Royal College of Physicians or nursing. Have they done some reports recently calling for more evidence in this area? NHS England, while it lasts at the moment, they also write reports listing various research as well that might need doing. So they're generally called evidence demand signalling for the NHS England. Have a look at those, see what's there. Just see what's going on and use that as a sort of a case to build up the need for your research because other people are also interested in this field and they're also calling for research to be done. If you are interested in applying using like a nice guidance research question or a James Lind Alliance, there are particular calls available for those too as well. So they are dedicated funding calls for all NIHR programs that if your research answers JLA, PSP, uncertainty, or a nice guidance research question, then you can apply to those particular funding streams. So always worth having a look, and then you can apply particular funding calls if it's relevant. If not, just use it as background in your application to all other funders that you choose to apply to. So we're going to spend most of this time just talking through an example. So we are going to use an example in COPD. So that is a progressive long-term lung condition, which makes it increasingly difficult for people to breathe. So if someone's got COPD, it causes inflammation and damage to the lung. And the resulting symptoms are things like a persistent cough or wheezing or shortness of breath, and that generally progresses. The damage is permanent, but treatment may help manage the symptoms, may also help slow progression. There are a wide range of treatments that people can access if they've got COPD. So that includes things like smoking cessation guidance and support, inhalers, medications, something called pulmonary rehabilitation, which is where we're going to focus our example. And in rare cases, there might be surgery. So we're just going to think about how we might take an idea in the area of COPD, develop it up and put it together to form a research application. So this is kind of what we're going to talk about now over the next few slides. So we have found a national COPD audit report, which was written by the Royal College of Physicians. So we've had a look through that. And we've noticed that one of the things they're reporting in this document is that across the country, there wasn't a particularly high uptake of pulmonary rehabilitation. There's only 69%. And, you know, as a COPD physician, we feel that could be higher. And it would be really good to investigate, what we could do to improve that uptake. So that's going to form the basis of our research idea. And we're going to do some investigations around what we might do next to develop that idea and start to move it forward to a potential research application. So we've got the idea from the report. So that has basically told us that the uptake of PR is only 69%. So we need to understand why this uptake is low. So the first thing we're going to do is we're going to go and talk to our clinical colleagues and understand kind of a bit more about why uptake may be so low. So on talking to our clinical colleagues, we've come to the conclusion that the referral into PR can come from really broad range of clinical colleagues. So it could come from a GP, it could come from a nurse, it could even come from a respiratory consultant. And during our conversations, we've also understood that their role isn't particularly focused on that behaviour change. Their role is just trying to move the patient on to the next treatment which they need. So we've decided, based on that, interviewing that group might be quite challenging because they are a really broad group. So we don't think that's a particularly worthwhile angle to pursue there. So we go and talk to some patients and understand from their angle kind of where the uncertainties may be for them. So let's go and speak to some patients, see what they think. The patients that we've met with have said, well, actually, they don't really know what PR is when they're referred into it. They don't really understand how it may benefit to them, and they don't really understand if it's really for them or not. So it makes them hesitant about going along and whether that could be appropriate for them. It wasn't really explained. They were just told that as the next step in their treatment pathway. So there's some uncertainty there we could think about. The next thing we're going to do is we're going to go and look in the literature as well and see what the literature says about it. So what the literature says is that patients generally don't have a particularly great experience when they are referred to it because the referrer isn't really reflecting what PR could do for them, and they aren't really sure, what it can do. There's no positive expectation shared with them. There's also a general sort of perceived lack of information regarding that purpose of what PR is. So should they go along, don't really understand the benefit of going along. So we're understanding them from a patient point of view, they don't really quite understand what it could do for them, and we really understand from the sort of clinical community that it's not really their role to sell why a patient should go to PR. It's just the next step in the referral process. So what we found is that there is a particular lack of perceived benefit around PR, and there could be a lack of information shared with patients from the clinical community. So we need to think about what we could do where we could improve that. So as part of our literature review, what we found out was that motivational interviewing has been used in other areas of health to encourage patients to go along to treatments, and so they can really understand what the benefit is for them. So that might be a potential angle we could take on this as well. So we could use motivational interviewing as a way to encourage patients to go along to their PR referrals, and that may increase uptake because people would understand the benefit, and they would also have more information about what the benefit could be for them. So let's look a bit more into how that might work. So how could motivational interviewing be used? So at the time of referral, could it work there? So this is the referral member coming from consultants or GPs or nurses. So it would require a lot of investment and training for those broad teams to be able to do it at that point in time. So we wondered whether it could be once the referral's been sent in to PR for these patients, could that person then phone up the patient and explain it to them? Would that work? Would that encourage them to come along to their appointment? So that could be a good particular place to target this intervention. And that's sort of similar pathways, it's where it's been used before. So there's potential this could be a good place to use it. And other work has also used manuals to be developed as well, so we can use that work to help support us. At this point in time, it'd be a good point to go and talk back to the patient community again, just to get their feedback on whether they think this is a good idea, whether it would be an appropriate time for them to receive this sort of intervention, and whether they've got any ideas around changing it or making it better or improving it. So always really important to engage with that patient group regularly to make sure that the study idea is working well for them, and this would be a good point to engage patients. So let's fit back to those original criteria that we had at the start. So how bad is the problem? So we can talk about COPD, we can talk about how common a disease it is, how many people in the UK currently have it. We can talk about PR, we can talk about how it's an important treatment for someone with COPD, and we can use our report written by the Royal College of Physicians to say that only 69% of people are taking it up. What don't we know? So we don't know whether motivational interviewing could improve the uptake of PR, but we're going to set that in the evidence to say that it's being used in other similar instances and it's really helped increase uptake of other interventions. Why might this work help? So again, we've got that other work set in other fields that says motivational interviewing can help. So this may help with PR referrals to help overcome communication issues, and may be a real benefit to increase the number of people uptaking their treatment. So will it make a notable change? So yes, it has a really important chance that this could make a difference. So we could increase the uptake of PR, which is a treatment for people with COPD, and it's already recommended in NICE guidance. So if we get uptake increase from 6 to 9%, it's going to have hopefully a big impact on the lives of people with COPD. Who'd call if this works? So professional body, the Royal College of Physicians, but that is based on clinical data as well. So there's quite a lot of people calling for this work. So we've got quite a nice background setting the need for this research in the background and the evidence, which gives it a nice strong case to move forward. So we're going to think about how we might start to turn that into a research question. So what we're going to do is think about, does motivational interviewing improve the uptake of pulmonary rehabilitation? That's kind of basic question of what we're doing. But could we refine that and make it clearer so that it's really clear from the reader when they first read that title exactly what we're going to do? So let's think about what we could change to that question to make it clearer. So at the moment, we've got does interviewing improve uptake of pulmonary rehabilitation? Let's improve that and add on to the end of it compared to usual care. So it's now really clear what we're doing in the study. So we're going to be taking one intervention and comparing it against what we currently do. Let's think again, can we improve that further? So we want to improve uptake of PR compared to usual care. But can we make that even better? So we could change it to what is the effectiveness of motivational interviewing compared to usual care in the uptake of PR. So that tells the reader exactly what we're doing. We're looking at the effectiveness. So does this intervention work? And we can compare it against usual care. So it's really clear to everyone what we're doing right from the outset when they first look at our application. And the process we've gone through to do that is PICO. NIHR use the term PICO a lot, and so do other funders. And it just stands for population, so those referred for PR, so individuals with COPD. And in that, we can include the particular stage of COPD they are at as well, just to give a bit more detail. Then we need to use our intervention, so that's motivational interviewing, and we can describe that in more detail. Our comparator is usual care, and then our outcome is our uptake of PR. So we are explaining really clearly what we're doing in a single sentence, picking out all those key elements of the PICO in our research question. I know that not all studies fit nicely into PICO framework. There are lots of other alternatives out there. So basically all PICO represents is a framework, and it's just a nice way to represent different bits of your project. But for other examples, so for example, observational studies, PICO might work better. So PECO, and there's SPIDER if you're using a qualitative or mixed method research, SPICE if you're doing sort of impact service type project, or Eclipse if you're looking for sort of health policy management research. But you can Google them. There's lots of others out there. Like I say, not wedded to PICO, but it does generally fit lots of NIHR programs. But absolutely find one that fits your research. It's just all about having a framework to logically explain each individual element of your application. So thinking about an aim. So an aim essentially uses exactly the same components that you would do in a PICO, but it's just not phrased as a question. I don't think you really need to include an aim and a research question. I think you can choose whichever you prefer. So most funders I don't think mind either. They usually specify aims and objectives, but that aim could each equally be a research question if that works better for you. And essentially to turn our research question into an aim, all we're going to do is just to investigate the effect of motivational interviewing compared to usual care on the uptake of PR. So we've just changed the wording around a little bit, but we've kept the core elements exactly the same within the aim as we had in the research question. And then to move from an aim to objectives. So we don't want lots of detailed objectives, short sentences. You don't need to discuss tools or analysis or any other details. That is for the project plan. So you can kind of think about the aim and objectives as the bones of the application. And then once you get through to the project plan, that's where you really start to add the meat to those bones. So what you're looking for in an objective is the major milestones or components for studies so that the reader's prepared for what's coming in the project plan. So for example, if you have a nested qualitative study, you'd include it as one of the objectives because that's an important component. Don't go into lots of details, keep it sort of simple, keep it concise. And then if you might want to link those objectives through to the individual work packages where you might answer those. For example, at the end of each objective, you can put in bracket work package 1 if that's where you're going to answer it, just so the reader then is primed where they're going to see more details further down in the application. So let's think about what our objectives might look like. So, for example, we don't want to include lots of details that aren't relevant. So, randomization is not a major part of the study. It's a method used to facilitate the assessment. Recruitment's not a major part of the study, so we don't need to think about adding that as an objective. A nested qualitative study would be a major part of the study. So we would want to list that. Assessment of cost effectiveness would be a major part of the study, so we would want to include that as well. So these are all about priming the reader. So in this example, what we'd probably go for is an aim of the study is to investigate the effect of motivational interviewing compared to the usual care on the uptake of PR. Then our objectives would be something like refined face-to-face motivational interviewing intervention that you can use over the telephone. And then you might put work package 1 in brackets after that. Then our objective 2 would be to determine the effectiveness of using a clinician-delivered MI with respect to uptake and completion of PR amongst patients. That could be work package 2. Assess the fidelity of delivery of motivational interviewing. Explore acceptability and perceived utility of motivational interviewing amongst patients, clinicians, and explore the barriers and facilitators. So these are sort of the key components of our study. So it's really clear kind of what we're doing in our application, and everyone understands what we're looking to do. And that also then allows a clear assessment of whether the methodology we're proposing later on would actually allow us to answer these aims as well. So this is one approach of doing it. It's a sort of fairly straightforward, easy way that you can approach an application. It doesn't overload the reader. It gives a clear signal of what's to come. It provides a clear structure, and it's very easy for the reader to refer back to earlier bits in your application and understand how it all links together. We're just trying, this is just a way to avoid overcomplicating. It's a simple framework to allow the reader to understand what's in an application, particularly if it's not their field. There are other ways of doing it though. And then moving on to the title. So key things to avoid in a title: don't use technical phrases or abbreviations unless they're particularly well known. Don't have a particularly over long title that's going to take 3 or 4 breaths to read it. It's supposed to be a really quick intro to what they're doing. Don't use complex terminology that can be saved for the aims and objectives. It needs to be descriptive, easy for people to remember, and sort of capture someone's imagination just because they can see what the essence of your project might be about. So how would you go about then doing a title? So for example, it doesn't need to be a form a catchy word. So I think quite often people think their title has to form into like a catchy acronym. You don't need to do that. You just need to have the title which is really clear and easy to understand. So don't fall into the trap of trying to put words together to make some sort of short, catchy acronym. It's not required by NIHR. So in summary, what is helpful to do in your application is to have a single question and aim, make sure it's watertight, take a lot of time crafting it. And then from there, take some time to craft your objectives and lay out how they're going to achieve your aim. Think about your title carefully. This is kind of the face of your application. It's the first thing anyone's going to read when they look at it. So again, make sure it's catchy, it explains what you're doing, and it's simple to read. And just try and structure your application in a really clear way. We've got a number of resources here, so that can be helpful. So there's links to NICE, there's links to JLA, if you wanted to look to see if people have particular research questions out there already, which you could use to frame your research. There's links to all the NIHR funding opportunities and all the MRC funding opportunities as well.